Foundation. Uh, yeah, just thank you all for threw me off there, Jay. Stop doing that. I have trouble multitasking, and I get easily distracted. But really, thank you all for joining us here today. I'm really looking forward to the dialogue, the conversation today, because we want this to be certainly, presentation, but we also want this to be a conversation. We want this to be a dialogue. We really do truly invite you to ask questions, share your thoughts, your reflections, interrupt. Really, that's what this time is for. We want you to jump in and be a part of this as a dialogue. I also just want to really thank Jace here publicly for really taking the bull by the horns and running forward with this. Last year, Jace came to us as members of the Asian Affinity Group internally and said, we just did not get the sample size that we were hoping for when it comes to the Asian American Pacific Islander community. How can we do a better job, and what are ways to do that? And Jace had some wonderful suggestions. It had interviews, and he'll go over this detail, interviews with many organizations, many individuals connected with a lot of different folks across the state. And this year, we're very pleased to say that, I think we got some real diverse perspectives as part of our Pulse annual poll. And that's really our goal with the poll, is to help hear the perspectives from Coloradans each and every year. So Jace Woodrum is our Senior Officer of Public Opinion Insights and is our guru with anything related to public opinion. And so I'm going to turn the mic over to Jace and allow him to take it from here. Again, thank you all for being here.
Thanks, Miguel. I appreciate it. No one has ever called me a guru. I think I may have called myself a guru before. That was wishful thinking. So thank you. And thanks everyone for being here. Introduce yourself on the chat if you're willing. We would love to know who's here. And I'll underscore what Miguel said. Please have a conversation. Have a conversation in the chat, or unmute and have a conversation about this, about the data. I'm going to share some data. It hopefully is interesting and useful for your work, and it'll probably make you have lots more questions that aren't answered. As much as I want every research project I lead to answer every question I've ever had, I haven't made that happen yet, and I doubt today will be the day. But I'm glad to see everybody. I'm going to share my screen. That's mostly to keep me on track and not to make this feel more formal. So don't let it. All right, hopefully technology is working for us. I want to start just by telling you how we do this poll. So Pulse, the Colorado Health Foundation poll, we did it last year, we did it this year, and we're going to do it next year. It's an annual thing for us, as long as they'll let me do it. And it's one of the things that I find a lot of joy in, because it really allows us to hold up a mirror to Coloradans and reflect back what we see. And we really ask folks about their experiences, their worries, their priorities, and we learn a lot. There are things we don't learn, but we do learn a lot. And so I'm excited to get to chat with you about it today. I'm really, really grateful for the help of so many of you on the line who helped us execute the survey this year. How do we do it? In 2021, we talked to 2,493 adults in Colorado. We talked to them July 27th through August 16th. We talked to them in English and in Spanish. And this is the way we talk to them. We pull a big list of addresses, randomly choose addresses. And through data matching, we're able to not just find out your mailing address, we can find out your email address and your phone number. And so we text people, we send them postcards, we call them, and we send them emails. We try to get them to complete this survey. That's how we get our random or probability-based sample. But many of you on the line also helped us conduct an oversample of Asian Americans and Pacific Islanders. And the way we did that is you guys reached out to your networks, the people you know, and you said, hey, fill out this survey. And between both of those two kinds of outreach methods, we got 143 interviews with AAPI Coloradans. That is important for us because that is what I mean by oversample is typically I would have not talked to that many people if what I was doing was a representative sample. I would have only talked to, say, between 3 and 4% of my whole sample would have been AAPI because that's what's representative of our population. But we wanted to oversample because we wanted to have increased confidence in our data. We wanted to have a more diverse sample so we could look at some of the nuances. And that's what we were able to achieve with your help. So excited to share the data with you, and apologize for the geek speak that I just went into. The overall margin of error for the whole sample is just under 3%, and the margin of error for the AAPI sample is just above 8%. And then the last thing I'll tell you in the nerdy zone is that one of our main goals with polls is to influence policymakers. We want polls to be used to make good policy. And so we use both a Democratic and a Republican pollster. They work together on every phase of the poll. And that is so that hopefully we have trust and credibility with folks from both sides of the aisle. Questions about how we do it? If you have questions, throw them in the chat, and one of my colleagues might be able to help you in the chat. They might speak up or just unmute. Again, this can totally be a conversation. You are not interrupting me. So questions about how we do this thing? Anytime you can ask me that. I'm going to cruise along. I want to tell you who these 143 people are.
Hey, Jace, I think we had somebody unmute themselves.
Oh, wonderful. I can't see you, so you're just going to have to holler at me. Thank you. Please ask your question.
Hey, this is Howard Cho. I just was wondering, when you said I work in market research. So I wanted to know, you were saying you're sampling. Did you reach out via text? Did you reach out online? Did you reach out doing phone interviews? What was your methodology?
We did all of that. So we did a multi sort of approach. So we reached out by email. This is for the probability-based sample. Reached out by email, reached out by text, reached out by actual phone calls, and reached out by postcards.
Okay.
Convenience sample, which was the organizations that reached out. They did not report to me how they reached out. I know many people put it on Facebook and use their own email list and text, but for the probability-based sample, we did all of those different methodologies, and then the convenience sample, we relied on our organizational partners. So important for someone like you is that the overall sample is representative, but the convenience sample is not.
Yeah, and I see the oversample, you got 143 and completes from the oversample of the AAPI.
Correct.
Okay, cool, that's it. Sorry to bother you.
No worries, no bother at all. It's nice when someone wants to know the nerdy details. Not to call you.
Oh yeah, I work in that industry. Yeah, no. So I did the polling for Barack Obama. So yeah, this stuff is what I do every day.
Awesome. So who are these folks? I have here for you, I pulled the ethnic background, and I was really happy with the diversity of the sample. Would love to hear if, when you look at this, does this feel good and right to you, the sort of ethnic backgrounds of our 143 respondents. I'll also flag the gender identity here. We really had 3% of our AAPI respondents identify as non-binary. That's not representative, but it's really interesting. Non-binary people, you don't often get a large sample. And this, I wouldn't say that this is large, it's 3% of 143, but it's kind of exciting to see 3% beside non-binary. It's not often what we see here. A few other things about our AAPI respondents. This is where they live. You'll see a concentration in the Denver metro area. Not a surprise. Most of our partner organizations are based or do their work in the Denver metro area, but we do have some reach outside El Paso County, Larimer County. I pulled the ideology here as well. The important thing to note is that we had a very liberal to moderate sample. These numbers for conservatives are quite low. So remember, when we do a convenient sample, we're not being representative of the population, and that is okay. Representativeness is not our goal here. Our goal is to listen to AAPI Coloradans and reflect back what we hear. So just a note, you may see some themes as you look at this data showing, that sort of lift up like, oh, okay, we don't have conservative AAPI people here in the mix. And I think you'll see that in just a minute when we look at sort of the first couple of data points.
Chase, I was noticing for the region that Douglas County isn't represented. Is that considered part of other, or did we not get any respondents from Douglas County?
You had 1% in Douglas County. I recall Douglas and Pueblo were both at 1%. And so I put them in with the other. So 1% from Douglas. Good question.
Thank you.
Sure. Here is the age of our respondents. Now, I will tell you, typically when you do a survey, it is really, really hard to get young people to participate. And yet, because of the work of our organizational partners, we actually had a lot of young people. You can see 46% of the sample is 18 to 29, 28% is 30 to 39. So when you combine that, basically like 3/4 of our sample are people who I would consider young. Now, perhaps I only consider them young because I'm 38, but pretty good representation here from young people, less representation of older folks, which ties to the parenthood piece. There are a number of questions in the survey that we asked, which are specific to just parents. When we look at those, I'll flag for you when we get to them as well, that we're talking about even smaller sample sizes here, smaller than 143, because 67% of the sample had reported having no kids under 18. There are more details about our AAPI respondents. How often do they go to church, their income, a number of other things. I can share that with you in a number of different formats. If that is of interest to you, throw your email address in the chat and we'll make sure. It would actually be great to have everybody's email address in the chat because I know some of you were invited by friends. And so we can follow up and give you this deck, the recording, and some additional demographic data if that's of interest. But are there any questions about our AAPI respondents before we start looking at what they told us? I cannot see the chat, so I hope one of my colleagues will holler at me if there's something in the chat that I should respond
Oh,
to.
Jace, this is Rochelle. I did put in a question because I was just wondering about parenthood. So does the no kids under 18 category include adults who have kids over 18?
It does, yeah.
Okay.
But because the questions we were asking were really for kids at home, because the questions are about childcare, whether or not you're going to vaccinate your child, there's no nuance beyond beyond 18. Great question, Michelle. Thank you.
Hi, Jace, it's Annie. I was a part of the group that we got to give feedback on the questions. And I remember we had suggested to add the question about Asian ethnicity. Was that easy to do? Like, just curious from the foundation's end, like, is that something like kind of like a best practice that like our community is recommending and something that you feel you can continue to do on future surveys?
I do feel we can continue to do it. And, whether or not it's easy or not, nobody told me we couldn't, right? It was a great suggestion. I told everybody else we should do it and nobody said, Jace.
So good.
Yeah.
Okay.
So I'm going to say, yeah, it was easy and we're going to keep doing it. I was really excited. I mean, Annie, when you look at this, how do you feel about having this data? I mean, theoretically, this means that you could look only at, the Chinese respondents, only at the Vietnamese respondents. We're talking about very, very small groups of people when we do that. But I was really excited to see this pie chart show such diversity. But how does it strike you knowing the community better than I do?
Yeah, I think it's pretty representative. I mean, as far as I guess like Chinese and South Asian Indian being like a bigger part, but the fact is like we just don't ever have any disaggregated data. So I think that's really kind of what we're trying to advocate more for and kind of speak up about for our community. And so I think we're going to start seeing it more and more because we really don't see it at all now. And it'll really help us address a lot of the disparities within our own community. So it is helpful. Thank you.
Got it. Well, I'm glad that we are able to do it and we will certainly continue to do it next year. Okay. And then the years to come. So let's start to talk about what our AAPI respondents told us. And when we start the survey, we start by asking about their concerns and we give them a list of concerns and we say, do you think this is an extremely serious problem, very serious problem, not too serious, or not serious at all? And here is what we heard when we asked our AAPI respondents here. Unlike any other subgroup, climate change is at the top of the list for AAPI respondents. Super interesting. I think tells us a lot about ideology that we looked at and the age of our responses that this popped to the top. The other things that are really high on the top, cost of living, cost of healthcare, cost of housing, those were high for most of our respondents writ large and for most of the subgroups. So what's unique here is that climate change is so high and essentially neck and neck, right? We've only got one or a couple percentage points. But the fact that climate change rose to the same level as the cost of housing, which is so top of mind for all Coloradans, and we actually saw a double-digit increase in the number of people saying the cost of housing is an extremely or very serious problem from year to year. So I thought that was a pretty interesting thing. You can see how these shake out in the extremely very serious column there. All of these having pretty high numbers of concern. Here's the next set. We've got 6 in 10 folks expressing concern about mental health and hunger. And then sort of toward the bottom of the list, only 1/3 are worried about jobs and the economy. So I think this is interesting. People aren't worried about the economy itself, only about 1/3, but they are worried about their own finances, going back to this slide where they're talking about the cost of living. So people feeling pinched and financially insecure, but not worried about the economy writ large. And of course, you know, I wish I could look at the data from last year. I can't do that because this is our first year we consider our benchmark year for our AAPI oversample to see how do people feel about the economy. Last year, in the whole sample, we saw concern about jobs in the economy decrease from 2020 to 2021 as the sort of economic downturn started to shift back upward. I'm going to show you the comparison data here between other racial and ethnic groups. This may look very, very small on your screen, but the sort of headline here is that AAPI Coloradans are expressing less concern about a number of issues. So when you compare, like, cost of housing was really high for a lot of folks. You see it's 75% for our AAPI respondents compared to 83% of white, 84% of Black, 83% of Hispanic, 93% of Native American. So interestingly here, having our AAPI respondents express less concern than our other racial and ethnic groups. Any questions about this data? Can you even read it? Thoughts, concerns, reflections, anything?
Dave, did you say it was available for us? The download or something?
I'm sorry, did you say it was, I didn't quite hear that question. Can you ask me again?
Hey, Jason, I just wondered if this was available for us to look at.
Absolutely. So my colleague Austin will put some links in the chat that will help you get to this, all of this data. So one of the core commitments of Pulse is that it's fully transparent. So we release everything. We release the crosstabs, the top line. We have a data dashboard built in Tableau. So that's one of the commitments of Pulse that's different than a lot of the polls that other people know about. So yes, all of this is available, and Austin will show you how to get it. Thank you, Austin.
That's awesome. Thank you so much.
Financial security is a big focus of the poll, both last year and this year, as we understand that your ability to keep a roof over your head, to afford healthy food, your ability to have a job and work and bring home income, all of those things have an impact on your health and well-being. So we explore those kinds of questions, and we explore them in two ways. We ask people to look back at the sort of last year and tell us, as you look back, what happened to you, what were your experiences, and then as you look forward, what are you worried about? And so I like that we have both sides of the coin here as we go through these. The first is a look back, and we asked folks, looking back over the last year, would you say you're better off financially, worse off, or is your financial situation about the same? And in this case, a majority of AAPI Coloradans say that their financial status is about the same. We've got 24%, about a quarter, who say better, and 18% who say worse. I've pulled the comparison data for you, and this comparison data is from the whole sample, so it's not AAPI Coloradans with some college or less. It's all Coloradans with some college or less. And you can see some of the comparisons here. AAPI people seem to be middle of the road, or we're not seeing an extreme disparity here. But that doesn't mean that we shouldn't be concerned by the reality that 18% of people are saying, hey, I'm worse off than I was, right? Those are real people. Almost 1 in 5 are worried about losing their home in the next year. So this is one of those questions where we say, hey, look ahead. How worried are you that you might lose your home because you can't afford the monthly rent or the mortgage? And we've got 17% of people who are concerned about that. Pretty low in terms of racial or ethnic group. Again, not an insignificant number of people, but fairly low when you look at the comparison data compared to, say, 38% of Native Americans. But overall, the sample, 21% of folks, about 1 in 5, say, I'm worried about losing my home. And then when we ask folks about being able to afford enough food for their family, 18%. So very likely, we're talking about the same respondents here who are saying, I'm worse off, I can't afford, I'm worried about affording my rent or mortgage, I'm worried about being able to afford enough food, right? This 17, 18% of people, likely the same group of people until now. Now we jump to a third are worried that they or someone in their household will be without health insurance coverage. So what's happening here? Well, how did we double when we asked you about health insurance coverage? I promised you that there would be questions raised that we couldn't answer in the data, and this is one of them. Because we're doing a poll and not a focus group, I can't say, why are you worried about that? Please tell me, please unpack that for me. We just know that we've got a lot more people worried about health insurance coverage than we do about affording food and affording a roof over their heads. Really interesting, and something I don't know why, but something for us to think about. And maybe you all have a sense of why based on your work with community. And if you do, I'd love to hear it. If you have an answer, that would help me sleep better at night rather than mulling these over.
I'm wondering if it's related to the demographic based on age. It seemed like a lot of it was 18 to 29. And I would imagine a lot of them still have health insurance with their parents.
Great thought. Yeah, age may be the factor there for sure.
And I'm wondering if that also contributes why climate concern is so high, because that seems like a very big concern among the 18 to 29 age group.
Yes, for sure. The other question we asked folks when we asked them to look ahead over the next year is if they were worried they might not be fully employed. We've got about 14% of people who say they don't plan to be employed for any number of reasons, students, retired. And then we've got 15% of folks who are worried about that. Pretty consistent or middle of the road among racial and ethnic groups. You'll see that I pulled out the age here. That made me I wish I'd pulled out the age on the last one. Given your comment, but so young people here worried about employment, that makes me want to go back and check the numbers on worry about health insurance. And I'm going to do that, though I won't do it in real time because you'll really see me fumble around. So I wanted to share with you the over time data. This is some of these questions we wanted to repeat. So again, we don't have the 2020 numbers for our AAPI sample, but for the whole sample, what we notice is that financial perceptions are not materially different from last summer. So there is less overall concern about the condition of the economy, but personal financial concerns have not shifted much. So think about where we were. We fielded this around the same time in August of 2020, when the economy was at a much more precarious place than it is now. And we still have around a quarter or 1 in 5 people who are worried about losing their home, worried about their financial situation, worried about affording food. And those numbers stay really relatively the same, which I think tells us that while COVID and the pandemic has created an additional financial burden for people, it isn't the sole source of the burden. And we can't expect people to stop suffering when the pandemic goes away, assuming it ever does, right? So we can't blame the pandemic for all of our problems, and it should really be a call to action to those of us who are working and serving community.
I was wondering if you collected data based on income, because as we know, like the people who are better off social economically, the pandemic didn't impact them as much as the people who are of lower socioeconomic status.
Yes. So let's take a look at, I'm going to zip back here. Financial status staying the same. You can see 43% of the lowest income respondents say it got worse. 29% of 30 to 50, which we sort of at the Health Foundation are looking at anything below 50,000 being someone living on low income. And then I'll share with you, this was as if you queued me up beautifully. So when we look at who has those 4 financial concerns, nearly half have at least one of those. And when you look at who's most likely to have those concerns, it's unemployed Coloradans and households with incomes over 50,000, or excuse me, under 50,000. So, right, 56% of people say, no, I'm not worried about housing, I'm not worried about food, I'm not worried about my job, I'm not worried about health insurance. But then 44, if I did that math correctly, have at least one of those worries. So absolutely, that is what we found. People living on low income, things just got worse or more difficult for them. We asked folks in the last year, have you experienced any of the following, right? So we've shifted now from looking ahead, what are you worried about, to looking behind, what happened to you. We've got around one third of AAPI respondents who have put off medical or dental care. Another great example of wanting to be able to ask why and not knowing, was it because of income? Was it because of fear of exposure to COVID or any other number of reasons? We've got about a quarter of folks who had their work hours or their wages reduced, 16% of folks who had trouble caring for aging or disabled family members, 11% who had to change their living arrangements because they couldn't afford the rent or the mortgage. We can look at these numbers in a comparative way. You can see here, it's kind of a mix, right? The story isn't one racial group across all of these experiences have had the most disparity. We're not seeing the most disparity here, but many of these numbers are cause for attention, cause for concern, reasons, 9% people skipping meals because you couldn't afford food, right? That's not an insignificant number of people who are struggling to afford a meal. I'm about to shift sort of gears a little bit, so I just want to pause and say any other questions either in the chat that somebody wants to lift up or just unmute and let me know if you've got questions or reflections on what you're seeing here. Okay, well, I hate sitting in silence, so the offer still stands. I'm just going to keep moving forward here. I can't see the chat, but I know my colleagues are watching it for me.
Jace, can you hear me right now?
I can hear you, Howard. Go for it.
Hey, Jace, I just want to ask you another question that we sometimes ask, especially when we're going into diverse neighborhoods, is how many of the people that we polled were primary English speakers? Do we have that data on this particular one?
We asked if they spoke another language at home. So I'd have to look that up for you, or that you probably can figure it out on I think the data dashboard. I don't know if I put that on the data dashboard, but yes, we have that, and we do have that data.
Okay, because that was one of the things that we were trying to do when we start going into a lot of our diverse communities, is we try to find the problem we've always had with sampling is trying to get people who were non-primary English speakers that had enough English to answer these type of polls and surveys. So I always want to bring that up to mind.
I appreciate it. One of the things we really thought about doing was how do we conduct polls in more languages. We conducted it in English and Spanish. We certainly wanted to reach as diverse a sample of AAPI Coloradans as we could. Our timeline really didn't allow us to do a whole bunch of translation beyond Spanish, but Howard, I'd really love to get your insights on how you have, if you have conducted surveys or other sorts of research in Japanese and Mandarin, Vietnamese, what you've done to do that, if you've done any of that. So let's maybe you and I connect offline and geek out a little bit.
That'll be great. Yeah, let's not get everyone else into the geekiness. So let's geek out later.
We're gonna spare you all. mental health and well-being, another big focus for us as a foundation, and it really popped in our 2020 survey. So we asked one, maybe two questions about mental health in 2020, and a majority of Coloradans said they had experienced some mental health strain. So we came back in 2021 and we wanted to understand what do you mean by mental health strain? What can we figure out? What's going on? And here you see how we've asked these questions, asking people to look back over the last 12 months. Have they experienced anxiety, difficulty focusing, depression? We've got nearly 2/3 of AAPI Coloradans report having experienced anxiety. That was the most common thing across all respondents, that anxiety was the highest, 63%. That's quite a lot of people experiencing anxiety. We've got 39% experiencing depression, more than 1/3 difficulty connecting with family and friends. So the mental health challenges are real. This is something that we're thinking about how and whether to track in years to come, so we can better understand the mental health impacts from the pandemic, which have been widely reported on and talked about, which I see as a really positive thing that we're talking about it more. So this is one way that we're trying to understand that impact. Here's the comparative data here. Really, these challenges with mental health and well-being, they cross racial and ethnic lines. I mean, there is not one racial group who has cornered the market on mental health strain. It's really quite widespread. We asked folks who they talked to about their mental health, if anybody, and we have a majority of our Asian American and Pacific Islander respondents talked to family and friends. Half, just over half, talked to somebody who had concerns similar to theirs. And then just 1/3 spoke to a health professional. Again, makes me want to say, why? Was there no one nearby? Was there no one you could afford? Was it only people with wait lists? Did you feel like there was stigma? All kinds of reasons why people don't seek out support from a health professional. Sort of an example of a place I would love to dig in more. But this is pretty common across the board. Talking with friends or family is more common across all racial and ethnic groups compared to talking with health professionals. As you can see, much lower folks. Majority spoke to family or friends across all racial and ethnic groups, and we're hovering right around 1/3 talking to a health professional.
Jace, this is Rochelle. Were these the only 3 options, or were there others that were offered as well?
These were the only 3 options that we gave. Is there something we're missing?
Well, I mean, there are a lot of kind of cultural brokers, or I think about all the different ethnic groups, right? Like promotoras or faith leaders. It just seems like mental health is it's an overall health issue. So I wouldn't limit it to only health professionals. So that I was just thinking that there are definitely others that certain cultural groups tend to go to as well.
Yeah. Oh, I appreciate that. One of the great things about doing a poll every year is that you get to iterate on questions and change them up and ask them differently. Both of those suggestions really clear. One of the other things, we phrased it as someone who has concerns similar to yours, and we were thinking of like peer supports, and don't know if calling out that sort of peer support language or promotora, I know sort of walks that line between peer support and health professional. So if someone did talk to a promotora, where might they have put that?
Right.
I'm not sure.
Yeah.
Yeah, and this is Kyle from the Health Foundation as well. Great questions, Rochelle, and just a teaser for the end of our conversation. As you listen to the data that we have from this year's poll, one of the questions we want to pick your brains about on the conversation today is like things that we left off of the survey this year, like things that you would recommend that we think about including on next year's survey as well. Jace mentioned this is an annual exercise for us. So the fortunate thing is we get another go round of this in just a few months, actually. So one of the inspirations behind this question was there's data from other places in Colorado about who and how many people who are experiencing mental health concerns actually reach out to professionals in some shape or form. But we were interested in knowing, like, beyond that, like, are folks talking to people who may not necessarily have a license or a certificate or something as part of a professional sort of credential that they're talking to. And so these were the categories that we came up with for this year. But if we wanted to ask about this and dig deeper on it again next year, are there different categories, other kinds of folks that you would recommend that we include? And by the way, our colleague who welcomed you on this call, Miguel, this is very well within his wheelhouse. He's deep in our work at the foundation about behavioral health. And so he'd probably be really interested in your opinions on this too. And then while I'm unmuted, Jace, Rochelle had a question in the chat about what was the percentage of Pacific Islander respondents? And Rochelle, were you thinking about the folks when we did our attempt to disaggregate the data on the AAPI sample, how many folks reported being Pacific Islander? Was that sort of the spirit of what you were asking about?
Yes, that was.
I don't know off the top of my head. I'd have to look back in the data and can certainly do that. And it's sort of hearing you ask that makes me think, how often do we just say AAPI and in fact, maybe we're not.
Right.
AAPI. That happens a lot when we do like LGBTQ. And
yeah.
Then we're not representing the whole acronym, but we're just so used to using the acronym. It's like, well, we have to use the acronym. So that makes me want to go back and look at that data, Rochelle.
That's what I was wondering about exactly, Chase. I'm like, are we really talking about AAPIs or are we just talking more about Asian Americans?
Mm-hmm. My sense is we are, and but I do want to check for you.
Thank you.
Sure. Now I'm really going to switch gears and we'll talk about COVID-19 vaccination. These numbers are dramatically out of date, right? Because we were in the field July 27th through August 16th, and a lot has changed since then. So I'm going to go through these numbers kind of quickly, and if you want me to dig in, we certainly can. Just know that we're pretty out of date now. We had 77% say that they were already vaccinated with at least one dose of the vaccine. That is very, very high. You know, as I've been tracking racial numbers through like CDPHE, I've always seen Asian Americans, AAPI. Now I'm self-conscious about using the acronym, Rochelle. I've seen those numbers be pretty high across the board. So we saw high numbers here. For folks who said they weren't vaccinated, and that's only 15% of our respondents, we asked what their plans for vaccination were. And we had folks really at every level, right? I'm still planning to get it as soon as I can. I want to wait longer. I'm not sure. I'm definitely not. About 1 in 5 say they definitely will not. That's lower than all Coloradans who over 50% say I'm definitely not, which I consider them then hard to persuade that when you say that. So some interesting data here. And then we asked about kids, again, really, really, really out of date now, because when we asked this, kids down to age 5 were not yet eligible. Our parent sample is only 27 people. So just always a flag there, but here's how we have folks who were saying 13% already vaccinated and 33% vaccinated as soon as possible. Not a tremendous amount of hesitancy, which is not really what we're seeing in national and state numbers. I mean, parents across the board are quite concerned, but a lot of the hesitancy has become partisan. And if you'll recall, we have a very liberal to moderate sample, not a conservative sample here. And unfortunately, very increasingly, the vaccine conversation is becoming politically polarized. I went through that super fast. Any questions on vaccination? If you are an organization that is working on vaccinations and you want to talk to people who have done a lot of research, that happens to be me and my colleague Joanne, who is on also. We did about a 9-month research project to understand vaccine hesitancy. I know some of you know about it and we've talked about it before, but if you don't know about it and you want to hear about that research, or you want access to some of the communications tools we put together, that project was specifically about racial equity in vaccine uptake. So all the research was focused on communities of color, and certainly lots to share with you if that is of interest. Questions about vaccination? Talk about racial equity. I will say one of the biggest challenges that I personally felt as we were writing our questionnaire, and I'll tell you the questionnaire writing process is super difficult. Our first draft gave us a 32-minute questionnaire. We have about 20 minutes. So we did some major cutting. These are questions that were on the first draft that never were cut because racial equity is a major commitment for us at the Colorado Health Foundation. But how we ask these questions was heavily debated, and what we include and what we landed on both for 2020 and 2021 are questions that we ask all Coloradans that compare white people to people of color, which may sound strange. So I'm just going to go ahead and flip and tell you. So we phrased the question, compared to white Coloradans, do you think Asian American Coloradans are more or less likely to experience the following? Be untreated fairly by police, receive poor quality or inadequate health care, be treated unfairly when seeking to rent or buy a home. Hotly debated whether or not a comparison question like this was the right way to understand the sentiment of Coloradans with regard to racial equity. Hotly debated about whether we ask about police, healthcare, housing, mental health, any number of things, economic downturns. We hotly debated that as well. And what we didn't debate was that we were going to include Asian Americans here because it was important for us to understand not just Black Coloradans, not just Hispanic Coloradans, which we have questions and I'll share that data with you, but also the perceptions around Asian Americans. I will share with you that the model minority myth seems to be quite alive and well. As you can see, it's pretty low numbers of Coloradans writ large who believe that Asian Americans face unfair treatment. When I share with you the numbers of other communities of color, you'll see very different numbers into the majorities or pluralities in some places. So really some sort of stark realization for me how pervasive the model minority myth really is. But what I think is even more important is that we understand how Asian Americans think about their own experience and the experience of people like them. And Asian Americans do perceive that they are more likely to face unfair treatment. Not a majority, 45% say unfair treatment by police, 48% in healthcare, 49% in housing. I'll show you the contrast here. It's pretty stark. So we have about 6 in 10 of all Coloradans believe that Black people are more likely to be treated unfairly by police. And you see around half who believe that Black Coloradans are more likely to be treated unfairly in housing and more likely to receive poor quality or inadequate health care. And then across the board, people of color are more likely than white people to perceive that Black Coloradans disproportionately face these experiences. And I've highlighted our numbers of AAPI respondents here who really overwhelmingly think that Black Coloradans face unfair treatment here, even more so than they believe Asian Americans face unfair treatment. They believe that Black Coloradans face unfair treatment. We asked also the same set of questions about Hispanic Coloradans. These are the numbers for all respondents. So a majority of all respondents think that Hispanic Coloradans are treated unfairly, more likely to be treated unfairly by police, and just under a half in healthcare and in housing. But once again, people of color are more likely to perceive that Hispanic Coloradans face unfair treatment. And again, we've got an overwhelming majority of our Asian Pacific Islander respondents who say that Hispanic Coloradans face unfair treatment. Last but not least, we asked about Indigenous or Native American Coloradans. And again, this is right at a half who perceive them to be more likely to experience unfair treatment. And this is really a chorus here, Coloradans of color, and again, our Asian respondents, majority, vast majority, really a very clear majority, saying they believe Indigenous or Native Americans are more likely to experience this kind of unfair treatment. When we work on the poll again for 2022, we'll consider how to ask about racial equity. Is continuing these questions so we can look at change over time the right way or the wrong way? We didn't see a lot of change over time when we looked at the responses to Black Coloradans, which we were wondering about because when we were in the field in 2020, it was right in the midst of summer of protests and sort of the racial reckoning that many of us have thought a lot about. And we didn't see a change. So that was sort of interesting. It was nice to be able to compare over time, but we consider every question every year, whether or not we repeat, whether or not we change, iterate, improve, get rid of. As Kyle said earlier, we would love your thoughts and feedback on how to not just ask these questions, but all questions. And speaking of questions, are there any questions right now about all the data I just got? 2 more sections and then we can stop sharing screen and chat a bit.
Jace, since there's silence, I'll jump in. This is Rochelle. How did you decide, or how did the trust decide on these 3 experiences as the unfair treatment experiences? Just curious
Sure.
what the thinking was for that.
Yeah, it wasn't easy. Police we have done, and healthcare we have done both years.
Okay.
Obviously, it was a really a national and statewide conversation last year. And a very active conversation still in the state and among state legislatures and in local communities. As I said at the top of the hour, policymakers are a key focus for us as an audience for hopefully using this data to make good policy. And there are still very active conversations about policing in local communities and at the state legislature. Healthcare, previous iterations of the foundation before I was around, did lots of research into healthcare and know that communities of color often report negative experiences in healthcare. So we wanted to understand that. And then housing is one of our major priorities at the foundation. Healthcare is as well. Housing, the lack of affordable housing, something that we're working on a lot. And so wanted to understand to what extent is equity something that people think about when they think about housing. If you remember many slides back, the cost of housing is among the top issues that people think about. But are they thinking about it in terms of equity for people of color or for people living on low incomes? Or are they thinking, I couldn't afford the house I wanted in my neighborhood, so I had to move further out, or my kid moved to Idaho because they couldn't afford a house. So we were trying to understand how people think about housing, not just in their own experience, but thinking beyond their own experience. Great question.
Yeah, good question again, Michelle. This is Kyle from the Health Foundation. Just as an FYI, one of the questions we asked in the 2020 version of the survey was essentially this battery of questions, but about having their wages or hours cut. So like in economic downturns, I forget the exact wording off the top of my head, but do you believe that people of color are more likely to be the first to lose their jobs, have difficulty finding work, like those kinds of things? We ultimately decided just for space reasons not to repeat it in 2020 or in 2021. But as Jay said, like this is one of the things that we truly wrestled with, like, are these the right things or not to really like ask about under this umbrella of racial equity, fair treatment of folks. Part of the reasons of why we ended up with policing, healthcare, and housing is there are other data sets in Colorado that can affirm that like there actually are real patterns of unfair treatment, racial discrimination, and bias by institutions in each of these categories. And so what we were curious is if that is documented through other data sets, do folks actually believe that or perceive that to be true in Colorado? But we by no means flatter ourselves that we've like hit all the right notes or the right ways at sort of looking at this. So if anyone has questions or curiosities that you'd recommend that we think about as we build next year's survey, by all means, let us know.
Thanks, Kyle. I think that makes a lot of sense. And thanks for the reminder again about like, this should be kind of building off of what's already existing and not repeating. And so one of the things that stood out earlier was the high percentage of folks who have concern or express concern over gun violence too, and or just personal safety, right? Like we know that has been a really big issue for especially the Asian American population this year, right? And so just in terms of thinking about next year's, that might be something to look into.
Yeah, we kicked ourselves right after we came out of the field and saw the numbers about perceptions of unfair treatment against Asian Americans, and we thought, should we have asked about violence? There has been such an uptick and increased consciousness. I like to think maybe maybe it's just us on the line who are reading those articles, but we kicked ourselves immediately coming out of the field that we didn't include that.
Angie wouldn't have known.
Right. I'm shifting gears to parenting and childcare unless there is anything else on racial equity or really anything we've talked about. There's no rules that say you can't go back. All right, hearing none, I'm going to talk about parenting and childcare and remind you that we have a small sample size of Asian American parents that were included. And in fact, it's 27 people. So we're talking about a small number of people. These are a set of questions we only asked of parents, and these are really about the experiences that their children are having. And about a quarter say that their children have struggled with their mental health or well-being and with their school or their learning. So in addition, 29% had difficulty building, maintaining friendships. A majority postponed medical or dental care. This is pretty interesting. For a lot of other subgroups, the parents postponed medical or dental care, but the kids didn't. So it kind of like, we always take care of our kids before we take care of ourselves. In this case, we don't have that. Again, it's only 27 people, and I don't know why. Is it a case of, for these folks, it isn't about not going because of lack of access. It's about not going to protect people from a COVID exposure, right? We don't know the reasons why postponed care. So I'm just guessing, which is probably not something I'm supposed to do when I'm sharing a data set. But this is how our folks answered, and this is a comparative data. Here, AAPI parents are less likely to report that their children have experienced mental health strains. Pretty major difference here. White Coloradans, 55%, Native Americans, 63%, the two highest, and we've got our Asian Americans at 27%. We asked a number of questions about childcare. It's a really active conversation, right? Nationally, the lack of childcare in the state, the affordability of childcare, bills being debated at the state level, Office of Early Childhood. I mean, it's a hot topic. And so we added it this year. We didn't ask any questions about childcare last year. And again, we've got a small sample size here, but we've got 43% of our Asian parents who found it more difficult to balance childcare and other responsibilities. A majority who have been unable to find childcare that's affordable. I mean, a majority, that's a lot. And you'll see in the comparison data here, it's the highest, right? They're way more likely to report challenges related to affordable childcare, and really across the board, they're higher essentially across all indicators. So childcare, a real pain point, at least for these 27 folks, but I think it's fair to say that for our Asian American parents, childcare is a real pain point for them, both the affordability, the finding it for hours that you need it, or the professional ramifications, right? The difficulty balancing childcare with their other responsibilities, or I thought this was a really interesting question, missing out or declining a professional opportunity because you just couldn't, because of a lack of childcare, the demands of childcare, especially in a pandemic year like we had. This really rose to the surface. The last section here, and I'll just blaze through it and then I'll stop sharing my screen so we can chat a little bit, are policies, right? So I'll say again that one of our main audiences is policymakers. And what we tried to do was understand, what was concerning people, what were the experiences that we're having, what are the worries, and then what kind of policies. So you'll sort of see like housing follows all the way through, childcare follows all the way through. We sort of have an issue that we tried to really wrap our hands around to some extent. And so the policies that we tested for folks, here they are. And you will see extremely high levels of support from our Asian American respondents. I mean, 96% for making health insurance more affordable. I mean, it's hard to get 96% of people to agree that puppies are cute, right? I mean, that is an extremely high number. They're all really high. I'll remind you that we do not have a real conservative lean to our sample. We have a liberal lean to our sample that could explain some of this. We have a young lean to our sample that could explain some of this. Also, I will just say that across the board, most of these issues have majority support. So this is not our Asian American respondents are not an extreme outlier here. And I'll just go ahead and show you across the board, Coloradans of color are more likely to support all of these policies that we put in front of them. And they have bipartisan support as well. So just so that in case looks a little bit small on my screen. So we asked folks about making health insurance and other medical expenses more affordable, providing more state-funded mental health and substance use services, increasing state government investment to help those experiencing hunger, updating laws to prioritize building more affordable housing, increasing state government investment to reduce the cost of childcare, and increasing government spending on programs to stimulate jobs and economic growth. Across the board, that last one about jobs and economic growth was the lowest across basically all of our subgroups, which it really underscores the sort of theme that I lifted up at the top, that people are less concerned about the economy this year than they were last year, but they're more concerned about their own finances and the cost of living going up and just everything being more expensive. So we're really seeing that they'd rather our policymakers make the things that they need more affordable than to stimulate the economy writ large. That's the data I have, and I would love to see your faces and to hear some voices other than mine. So I'm going to stop sharing and just see what questions folks have or reflections or thoughts that they want to lift up. I won't force you to stay here for another 30 minutes if you don't want to be, but I do want to create some space just for some conversation about what stood out to you and any advice you have for us for next year. And then I'll also flag that my coworker Austin is going to show us the data dashboard. So that was a lot. Let me pause. You guys talk.
Hi, Jace. This is Harry from
Hey, Harry.
RGC. Sorry, I joined in a little bit late, but quick questions. It seems to me like the sample size for the AAPI community is about 27 people. Is that right?
It was 27 parents. It was 143 people who identified as Asian American.
Got it. And do you have like a demographic slide on the AAPI that did the survey, like, you know, their liberals, conservative age group, all that stuff?
Sorry
if I missed it.
You missed it, but you were not the only person who missed it, I feel sure. So let me just flash it right back up here again. If I can, I am not on the right slide. Let me try to get there. All right, are you seeing it? Maybe.
Yeah, we've got it, Jace.
Okay, thank you. So here are some of the demographics. There are more, and all of the data is available. And I'll do a follow-up if I can make sure I have everyone's email address with a couple of different ways to look at this. But here's ethnic background, gender identity. We've got county and ideology. You probably heard me mention, Harry, that we have a very liberal sample. And a liberal to moderate and very little conservatives in the sample. And then we also have a very young sample, which is why we had fewer people who had who had kids under 18. So that's why the overall sample size being 143, but only 27 parents for the questions we specifically asked parents. I can leave this up for a minute for you, Harry, if there's anything specific you want to look at while I'm answering any other questions.
I'm good. Thank you.
Sure.
Hey, Jace, this is Howard.
Hey. Go for it, Howard.
Hey, I just wanted to say, definitely would love to participate. And like we're starting about chatting offline about obviously the geekiness, but also about the framing of the questions, how you decide which ones to ask, because those are probably some of the most important things, and also the order you ask them. So there's a lot of different ways to follow up certain questions with other ones. And, you know, as Annie knows, I've been working in market research for about spanning 4 decades actually now into 14 years. So I would love to kind of definitely give some input and look at ways to, because we still, even today, you know, the firm that I work in, we do a lot of great work within diverse communities, but it's still the one thing that we think we don't do well enough, as with nobody does really well, is to grab those people, especially the barely English speakers sometimes, or a lot of people that don't take surveys when we're trying to reach out more to those people that are hard to sample. And so I love to kind of, not only talk about the geeky part, but also talk about how maybe certain framing of questions, certain outreach also to reach deeper pools of samples as well. So yeah, I left my information in there. I would love to kind of have a chat with the whole organization that put this together to kind of further it and improve it and look at other ways that we can do it. Because I'm also on my company's DEI committee, and we're doing things exactly like this as well. So love to help contribute any way I can.
Howard, thank you so much. My colleague Joanne, colleagues Joanne, Austin, and I are planning to do as much community engagement as we can as we plan for 2022, talking to folks and getting their thoughts on not just what questions we should ask, but also like what data is useful, right? It would be great if we didn't look at this data and say, gosh, that's interesting. But if we looked at this data and we put it in front of policymakers, or we put it in grant reports or whatever, like let's make it useful. And so Howard, I would welcome a conversation with you and with others on the line to talk about how we make this a tool for more folks to use, especially because it'll be around every year. So anyone who would be willing to have me follow up with them, please do put your email in the chat. And I know my colleagues are saving those for me. I'm technologically inept at times. Austin, will you share your screen and show the dashboard real quick? I just want to show you how to, so Kyle put what we call the top lines. You can see the exact order that we asked questions. So he put that in the chat. And then what Austin is showing you here is the dashboard. The dashboard is our attempt to make this data as accessible as you can. So you load it and then you choose a section, choose whatever section you would like, Austin. And then it goes into those questions. And when the data loads, and I see, yeah, Austin, if you've had it up for a while, you sort of have to reload. It populates the questions and then it gives you ways to filter the data. Now, these are not the only ways to filter the data. And if you're a super geek like me, you can look at the crosstabs and look at many other ways. But these are some of the ways that we think people most often will want to filter it. So you can filter by race and ethnicity, gender identity, sexual orientation, age, income, ability, political affiliation, and region. So you choose, and you can choose multiple, right? So you can choose Asian Pacific Islander, living on low income. Now it'll tell you how many people we're talking about at that point. Now we're talking about 13 people who are AAPI and live on $30,000 or less. It would tell you, AAPI and gay or lesbian, right? So you can mix and match or use multiple filters to look, and the data changes for you. So we try to make this accessible for people to use in whatever format that they find helpful. So I wanted to show that for you. Hopefully you can come and spend some time with it. The other things that you can download are just below this dashboard, and there are really any way that you would like the data. We've tried to make it available. So dig in, go wild. Thank you, Austin. What other questions do folks have, or reflections or thoughts?
Jason, I guess I'm wondering, how much work is it on your end to show us some of it with the ethnic breakdown? Because I think when, one of the first things you showed was like what people are worried about. And I guess I do wonder, what would it look like if we could actually see it across ethnic groups? And then it was like income, and there was one where it was like 10% were laid off this year. It's like, would we be able to see, like, if it's like a ethnic group that we know predominantly works in like a certain industry that had a lot of layoffs or something like that, like if it would be possible to add a slide or two in after some of those. And then even with the COVID vaccines, we know you're talking about how it's very political, that in our own community there's that political divide. So like, would we see, for example, that more Vietnamese people are not getting vaccinated? Like, we've been trying to do work in the community around vaccine education. See the broad stroke of like, okay, yeah, the community is doing really well, it's doing better than other communities. We end up just leaving people behind in our own community because we actually just have no idea. And so I think what you were saying about what data is helpful for our community, and kind of what Howard's saying about trying to inform next year. I do wonder if maybe you could have this, could design the surveys where, like, once they do answer like identifying with Asian, it kind of takes them down the Asian questions, maybe that maybe other ethnic groups don't care as much about, but that we could give input on, like, this would actually be very helpful for our community. And so with those racial justice questions, I do think about, like, could we have asked, like, have you experienced something, like, do you feel fear going out to the grocery store now? Like, kind of like, these are things we are hearing in our community, but it's so anecdotal. Like, we don't have like a formalized way of gathering the data, but if we could use the pulse to do that, and maybe they're questions that aren't relevant to, like, the other communities of color, but we could help design that, and so same with I know I would ask you to do, like, if you selected Asian under race, now select the ethnicity, right? So that could just be a question that only pops up if it's, for Asians. So.
Yeah. So as far as looking at the data by the ethnic groups, I could probably ask our data geeks to pull that. And, I would just say that we're looking at really small sizes, right? Like, what was, I think it was like 7% were Vietnamese. And so that's 10 people, I think, if I put it in my calculator correctly. So, I would just say, like, we would want to be really careful at how we use that data so that we're not misrepresenting people's experiences. And I think there's a way to do that, right? Like, there's absolutely a way to be careful with how we use this data and to make sure that it's used for good, not evil, right? The other piece of it is, you will not be surprised to hear that you are not the first person to say, hey, can you do this on Pulse? And it's really a balancing act for us now, and figuring out, like, what can we do in 2022? The harder thing about 2022 is that we are changing our timeline a bit. We are going to release the data in June before the primary, which means that, like, we have to move a little bit faster and make some of these decisions a little bit faster. So I would love, Annie, and I know you looked at the questionnaire this go round, and I would love to do that again, have you do that again, and folks who would like to give us some feedback and would really like to engage in the sausage making. We welcome that, and we are at a stage where we can't promise everything to everyone. And so it's a balancing act of what we can and can't say. And I would love to think through how to make this a useful data source for your work. I see a question in the chat, mixed heritage, yes. Yes, we did. Let me look at that for you. 8% multiracial. That was a selection, 8%.
And I was curious of that 8%, how many of them were like part Asian descent?
This would have been all part Asian. So
oh, I see. Okay.
It was a sub, yeah.
That's good.
Any other questions? Kyle, sorry, I see you unmuted. There's something.
Yeah, just to Annie's question about essentially, are there certain questions that we can build into the design of the survey where we're specifically asking AAPI response to those questions? That is possible. Like, we can build it into the skip logic of the survey and all that. So as you reflect on the information that we were able to collect and to listen to in this year's survey, like, if there are things like that that you'd like to suggest to us or recommend to us for next year, with Jace's sort of caveat in mind of, like, that's a sooner than later kind of question for you to reflect on. We're really interested in that feedback. And one of the other things that would help us out too is to get feedback from you about, were there questions on this year's survey that you absolutely want us to repeat? So don't cut this one from next year's survey. It was really interesting, really valuable to have this information about AAPI Coloradans in the survey as well, because that's something that we do look at, like, is it worth repeating something we asked this year? We have like a long list of things that we didn't ask this year that maybe we want to ask next year, or emerging issues and all that. So we have to balance those two things. So giving us some like temperature checks of, like, this is the stuff that's worth keeping is also really valuable feedback. And then the other thing that I would sort of like lift up for you all to think about, to reiterate our thanks to you and to many others who helped us to get to this oversample of AAPI folks in this year's survey as well. We're hopeful that this data is useful, valuable to your communities, to your partner organizations and all that as well. But one of the reasons why it was really important for us to invest in working with you all to make this possible this year is that we know that there are lots of other data sets out, all Coloradans, or to reflect the experiences of everyone in Colorado, and AAPI folks who are included in those surveys are just lumped into this big other category. So if there are other surveys out there in Colorado where you really like the question, but data about AAPI folks is not available in that survey or that data set because they don't have the sample size to get there, let us know, because that would be really valuable for us. Because that's one of the things that we think about overall with the Pulse questionnaire is like, is this data available somewhere else? And it may be, but only for certain racial and ethnic groups in Colorado, and more often than not for AAPI Coloradans as well. So that could be something that, if it's a well-worded question that's valuable information that we have for other groups, but we'd like to have it for AAPI folks, one of the real assets of Pulse is the very large sample size that we have every year. So that gives us the ability to report data on subgroups of Coloradans that isn't possible in lots of other surveys. So if you've been looking at data from other places and wishing that you had that same information for AAPI Coloradans, let us know, because it's a lot easier to copy and paste a question from somewhere else than to sort of stretch our minds to come up with good wording all on our own for creating something for us. And it also gives us a chance to like compare potentially to other data sets too, if this question is asked in other places.
Yeah, I would say, Kyle and Jace, I think the data that's really useful for my work is the rate of depression and anxiety in the community, because it reflects what I'm seeing within my organization, like the higher number of clients who are seeing, the higher level of acuity and symptoms, and the challenge we're facing in keeping workforce, because a lot of the workforce now wants to just become private therapists. But as you see from Colorado Sun article a few days ago, a lot of private therapists are now quitting Medicaid service out of anger because of the mismanagement of the money and how Medicaid saying that they owe money. So a lot of private therapists, so it's kind of putting us in a double pincher as we're losing workforce, but then they stop accepting Medicaid.
The other question I have is around how the data is also shared and presented. I know that the Health Foundation supports an equitable evaluation group. And one of the things that we've been talking about in that group is how data tends to be centered around white groups. And so I will admit that as I look at the charts, as you're putting them up, like white comes first. And I'm curious around why that is, and if you might consider going alphabetical or move, like I think white is always centered. And when you're trying to create an equitable approach to this work, I think it's really important to center and to put forth either things alphabetically and or not center white as the prominent. Because then we tend to all look at what's our comparison to white. I mean, that's how I was looking, because you go left to right. And so it's just, it's a visual that I think is.
You froze on me at the very end, but I think I got it. I got that like terrible, your internet's unstable message, but hopefully you can hear me.
Yeah.
I am so grateful for that feedback. And I do think it is a very easy change that we can make. I will also say that, the comparison to white, we wrestle with it a lot because the aim is to understand disparity. We're an organization that's about advancing equity. So it's like, of course, we do this comparison because we think it helps us understand disparity. And yet it is inherently feels very wrong. Why do we have to understand that this happens to more people in this group versus this group, when we can just say it's just not great that 18% of people can't afford food, period, right? Regardless of the comparison. So I love concrete suggestions like that. And I can very easily say like, yeah, there is no reason that white needs to go first when we look at this data and present this data. And I would welcome other suggestions like
that. I just wanted to add
again, for those who were here at the very beginning when Jace talked about the oversample that we did this year compared to the previous year. Looking ahead, as Kyle mentioned, going forward, we want to continue in this method of oversampling, and I think that this year was just the start of like what we can achieve, and I think as I think maybe Annie, you asked the question around disaggregated data along ethnic lines, and you can see that once we start doing that, we start getting to some smaller numbers. And Jace, I don't know what sort of the upper limit is on oversampling, but I certainly think that there's got to be room for us to have more representation from various different ethnic groups. I did see in the chat too a comment earlier around is the Japanese ethnic group maybe overrepresented compared to the population of Japanese Americans in Colorado compared with other Asian and AAPI groups. So all that to say, please help us with the connections to the communities that you serve, to the organizations that you're connected with that we haven't reached out to, that we should be reaching out to and connecting with to help us reach some of those voices. We put our heads together internally to try to figure out, okay, who do we need to reach out to? Who should we be connecting with? And then we did so, and then you all gave us some more suggestions as well. But please continue that, because we certainly feel like this is just the start of what we can really do to deepen our understanding about these issues and these questions related to Pulse.
Thank you, Miguel. I will say there's no limit. More people taking the survey is good, because we can always address in the weighting any overrepresentation, and ultimately, right, if we want to understand how Japanese Americans living in Colorado respond to these questions, we need to hear from more, even if that means they take up more of this pie. I'm still looking at the pie over here, you guys aren't. So more is better. And it helps us get the data that is disaggregated. I mean, I hear you all loud and clear, like this sort of acronym and blending it, we lose so much nuance. And so more people taking the survey is more people taking the survey, and that is better.
Yeah, thank you. And I think one thing we could suggest next year, working with organizations and having people promote, because I know a lot of the efforts was still like, oh, we were just sharing it on our social media and like kind of sending it out, but actually encouraging people to kind of like sit down with their parents and do it with their parents, and I think that's what really was a little different about the census, was that there was so much effort in, communities of color and the Asian community. It was really like, oh, you got to talk to like everybody, to fill it out, and then, the household person could fill it out for everyone. So kind of what Howard was saying about the hard to reach groups, it's like, I think, I'm sure I took the parents and asked them all the questions again and kind of filled it out for them. I don't know what you all think, like if that's okay, but maybe using that as a strategy to say that, we know in our community, a lot of the work is done through the young people. It's like the younger generation, the ones that can speak English, kind of spending time doing that with the kind of older generation. So maybe using that as an approach to say like, okay, not just like fill this out yourself, but really like sit down with the people around you. Like, we need the data, we need your help,
That's
Hey,
really helpful. No, sorry, go ahead.
Also, Jace, hey, how is this weighted?
Yeah, I have to put you in touch with someone smarter for that.
Okay, sorry. So, because I'm going to give you those geeky questions, because that matters. We do a lot of weighting and stuff. So, I mean, obviously, sometimes you get more responses from one or another. So that's why weighting is so important into finding out a true kind of like a true snapshot of what we want to look for.
I have a question maybe along the same lines. Hi, my name is Avery. So given that the sample leans more towards like the younger and more liberal group, like when comparing the AAPI sample to other groups, is that also the case for other groups? Like, are those factors the same? So I'm just curious, because is it reflective of AAPI, that portion of the identity, or just the portion of the identity that's more related to being young or being more liberal and stuff like that?
So the other racial and ethnic group that we did a convenient sample for, and when I say convenient sample, I mean like not just the probability-based random sample, but also working with community-based organizations, was Native Americans. We did not see a young skew with the Native Americans. Now, the sample size was 103, because they make up between 1% and 2% of our state's population. So very small population and a small sample size. But it did not skew young, nor did it skew partisan, like liberal. So now I probably don't want to go so far as to say it is because people are AAPI. You know, I don't want to overread into what we did here, because you know, so much of it is at play, right? This is not random sampling anymore. We were working with community-based organizations. Maybe all of the community-based organizations have like they serve young people, and it just happens, right? It has nothing to do with anything other than that. So I don't want to go too far to draw conclusions, but that's the other example.
I'm wondering then if there's a way to kind of separate that, like what Annie was saying in terms of separating that data for a particular age group, or I mean, I guess not so much with the political side of it, maybe not as likely, but maybe with a particular age group to focus on that compared to other groups, maybe in terms of age, to kind of balance out a little bit of those factors.
Yeah, I mean, certainly, right. When we look at the whole sample, we use weighting to help make things representative. We didn't do that here in the sense of like weighting within. So like, we didn't look at those 103 people and say, oh, only 12 of them should be young, so we're going to weight their responses. That like, we didn't do that within this sample. I actually don't know if you can. Again, I'm getting out of my depth. There's way smarter people like behind the scenes. So I don't know if that would be okay or how, but I'm happy to explore that with the smart people who are hiding in the background.
Thanks.
Yeah, I will say, like, one of the other opportunities for us as we think about this, you know, this is not a one and done survey. We're doing this every year going forward. Is the AAPI population in Colorado is growing too. So that means that year over year, it's likely to be that we'll get even more AAPI respondents through the baseline non-convenience sample methodology of the survey as well. But that's why we really appreciated the advice and the suggestion that we heard from many of you to ask the follow-up question about ethnicity within the AAPI population. And because it gives us a sort of a clue about like what to think about, what to ask about when we hold up what this sample looks like with what we know the actual population of AAPI folks in Colorado looks like. So we could say, like, you know, does it sort of track with what we know about AAPI folks? If it does, like if we know that in general, it's a generally younger population than other, like the rest of the population in the state of Colorado, we could compare it to other data sets like the census, even though we know the census data has some flaws and limitations to it as well. But it allows us to sort of say, like, you know, what is it about the sample that sort of like might hold true? And what are some of the things we would want us to sort of prompt and ask some deeper questions about, like, who might be left out of this sample, or where might we need to listen through other methodologies as well? And that's another point I just want to bring out into the conversation, is that quantitative methods like polling have value. There's a lot of power with what we can do and how we can learn from listening to people through this kind of listening, but we also invest in more qualitative ways of listening to folks, where I like to think of Pulse as like a shallow conversation with a lot of people, but we also are really interested in having deeper conversations with people as well. And so which oftentimes involves more qualitative methodologies like focus groups, other things like that, where you get to ask some of the follow-up questions that you heard Jace mention of, like, oh, this is really interesting. Like, there's this pattern in the quantitative data, but it doesn't tell us why or what's driving, what's really behind that. a lot of those kinds of questions are better suited to explore through more qualitative methodologies too. So we're also interested in like, what can we not learn through Pulse, and what are some of the other sort of ways of listening and follow-ups that we should be doing to better understand the experiences, the perspectives of AAPI folks in our state too.
Well, we are just about at time, so I just want to close this with a few reminders. One, all the data is available. There is so much. Two, if you put your email in the chat, I will follow up with this deck and another couple of resources that are really specific, because a lot of the downloadable things you might have to work a little bit harder to get into the subgroups. So I'll send you the easy things that lift up the AAPI data. And then Austin earlier put in the chat, we wrote a blog post about this. It's important to us to bring the data back to the people who helped us collect it, which is what we're doing here. But it's also important that the nuances that we worked so hard to get don't get lost when people just look at the top line data. So we wrote a blog post about our AAPI responses, and Austin linked to that, so you can see that as well. So there's a lot to dig into, and then we're going to do it all again. And we're going to do it all again faster. So if you'll be getting an email from me, follow up with these materials, but also we'll follow up with you to see if you would like to give us some feedback on 2022 and weigh in and give us some thoughts. And that's going to happen likely in January and February. So it won't be long before I'm asking for more help, I guess is what I will say. So I am very, very grateful that you tolerate all of my requests for help and how little I give back, except for just a sincere thank you. We appreciate it so much. Miguel and our Asian Affinity group connected me with all of you, and I am so grateful that they were willing to do that and that you've been on this journey with us. Kyle, I see you're unmuted. Would you like to send us away with some parting thoughts?
No, just one other addition to what you said. All the data is available. It's also shareable too. So you have access to this, which is great. But if you want to spread the word to other organizations, other contacts you have in community, by no means, this is not a secret. It's out there, it's available. And if there are other ways of like packaging it, presenting it, that makes it easier for you to share with other folks, like that's really valuable feedback for us to hear as well, as we think about like how to present what is a mountain of data in digestible ways out there. So if it's useful to other people that you know, feel free to forward on and to share this with others too. And thank you all again for joining us for this conversation today.
Thank you. Bye.
Bye, everyone.
Thanks all.